If retrofitting our towns and cities will progress this slowly, how can we utilise our current built environment and encourage people to get out and active?
Has everybody got their fobs? Yes. And everybody got their maps? Yes. Okay, let's go.
Beat the Street is an initiative that tries to encourage people to do just that. Children and their parents receive maps and key fobs and are encouraged to seek out beat boxes placed in random locations around the local area. It's essentially a treasure hunt and a way to make exercise more fun.
Alina, is it hard to get the kids involved?
It isn't hard to get the kids involved because they see it as a massive treasure hunt. In terms of the parents, it's slightly more difficult to change their behaviours. So this is why we kind of use the kids to pester the parents a wee bit to come out and play a game with us. And by that means to get them physically active as well.
What do you get when you have your points?
So we have lots of incentives. So we have lucky taps, so we have free passes to gyms, free swimming lessons, or their total prize is €500 of fitness vouchers for lifestyle sports this year. Yes.
In its first year, over 10,000 children across the country took part, and it's hoped that numbers will greatly increase next year. This is one of many initiatives funded by a new organisation called Healthy Ireland, set up recently by the Department of Health. I asked Dr. Kate O'Flaherty from Healthy Ireland what it's all about.
So Kate, I feel like a lot of the focus in Ireland and around the world is trying to make sick people better when they're in hospital. What's changing dynamic-wise?
Well, that's what most people think about when they think about the work of the Department of Health or the Health Service. But Healthy Ireland, which is our national initiative led by government, but really to involve everybody in Ireland about improving health and well-being. So it's really about a shift in focus to prevention, because a lot of the chronic disease and disease that people know about, like diabetes or heart disease or even cancers, a lot of them are preventable through lifestyle changes, essentially. So that's things like watching what you eat, having a healthy weight, not smoking, being physically active. And we do know that there's lots of factors that can make it easier or harder for people to make those changes and to be healthy.
Why is prevention so important?
Well, I suppose when you look at the level of chronic disease in the population, and as our population ages, so people are living longer, which is great, but they're not necessarily living healthier lives. So that's a huge, I suppose, cost burden on the health service into the future and the economy. So there's a cost element to it, but it's also really in terms of the quality of life of people, of lives lost, of opportunity lost. And we know the evidence shows that a lot of chronic disease is actually preventable. So I think that puts a real big responsibility on us to just try and to implement the evidence that's there, the policies that are there that show it is possible to prevent a lot of that disease, for our children to grow up being, I suppose, more active, having better physical and mental health and well-being, and then, as I say, being able to achieve their potential in life.
Only time will tell if new initiatives like these will be enough to turn the tide and help us to live longer and healthier lives. Obesity and chronic disease are threatening to cripple our healthcare system. And while we need to take personal responsibility for our own health, it cannot be denied that our environment plays a huge role.
We have to demand greater investment in our environment to make it safer and easier for us to be as active as possible if we want to have a healthier Ireland for generations to come.